Hello and thank you for joining me. My name is James Fitzgerald, a Vermont State licensed clinical mental health counselor. My private practice is James Fitzgerald Therapy, PLLC, located in South Burlington, Vermont. I am a national certified counselor by the National Board of Certified Counselors. I'm a member in good standing with the American Counseling Association and a member of the Vermont Counseling Network. I'm a certified life coach and a certified health and wellness coach. My universal treatment plan, psychotherapy program, and health and wellness program is called Strengthening Your Conscious Self. It was copyrighted in 2022. After watching this video, you will have learned a great deal about mental capacity and how it relates to informed consent. You will understand what I mean by mental capacity, critical thinking, and informed consent, and how those relate to your ability to choose to engage in therapy of your own volition. Understanding, developing, and enhancing your mental capacity is crucial for personal growth, well-being, and achieving your full potential. This video lesson will provide you with insight into what mental capacity is, why it matters, and how you can cultivate it in your daily life. Why is mental capacity important? Mental capacity is a fundamental requirement in the realms of psychotherapy, health and wellness coaching, and life coaching. It pertains to your ability to understand, retain, and evaluate information necessary to make decisions about your own health care and treatment, and your ability to choose the safest, most reliable, and most effective interventions and techniques for your healing and growth. Addressing mental capacity at the outset of any therapeutic or coaching relationship is crucial, as it determines whether you are ready, willing, and able to participate effectively and meaningfully in this process. There are healthcare consumer protection laws in the United States that protect you, pertaining to mental capacity and informed consent. These laws are essential in the fields of healthcare, mental health, and the legal system, ensuring that you have the ability to make informed decisions about your treatment and other significant life choices. Mental capacity encompasses several cognitive abilities, including comprehension, memory, reasoning, and decision-making. These abilities enable you to process information, weigh the consequences of different actions, and make informed choices. Mental capacity is not static. It can fluctuate due to various factors, such as neurological problems, mental health conditions, cognitive impairments, illness, disease, environment, stress, and fatigue. Therefore, assessing mental capacity is an ongoing process rather than a one-time evaluation. It is ethically prudent for me to ensure you provide me with proper informed consent to treatment that is well documented. Informed consent is a legal and ethical doctrine requiring that you understand and agree to the terms and potential risks of a treatment or procedure before it is carried out. This involves providing you with information about your symptoms, behaviors, and diagnosis, the proposed treatment plan, the potential benefits and risks of my program, and alternative options. Informed consent is a cornerstone of legal, regulatory, and ethical practice in therapy. Without adequate mental capacity, you may not be able to provide valid consent, potentially compromising the ethical foundation of our therapeutic relationship. Effective therapy relies on clear, open, and honest communication. Understanding your mental capacity or lack of helps me tailor my communication and intervention strategies to meet your needs. For example, complex information might need to be simplified, or sessions might need to be paced differently to ensure you are able to follow instructions and engage in the process. Mental capacity influences your ability to set and achieve realistic goals. Assessing mental capacity helps me identify any cognitive or emotional barriers that might impede your progress. This understanding allows for the creation of personalized and attainable present and future-oriented goals, fostering a sense of accomplishment and motivation. If you are experiencing impaired mental capacity, you might struggle with engagement in sessions and compliance with medication and homework, and/or struggle making it to sessions at the scheduled time and on the scheduled day. You might find it challenging to remember homework assignments, understand therapeutic techniques, or follow through with action plans. Early identification of these issues allows for the development of strategies that support you, not shame you, such as breaking tasks into smaller steps, providing many different types of media for you, or providing you with written summaries of your sessions. Let's discuss the process of assessing your mental capacity. Assessment of mental capacity involves a comprehensive evaluation of your cognitive and emotional functioning. This can be done through structured interviews, standardized assessments, and observations. Mental capacity is typically assessed with various tools and tests to determine your ability to understand and make decisions. A complete and thorough mental status examination is the first step in determining your mental capacity. In some cases, a formal legal process may be required to determine mental capacity, especially if there is a dispute or if the decision involves significant legal or financial consequences. Many times I am assessing your capacity and ability, and you may not even be aware of it. The following are the key areas I assess. As your therapist, I want to assess your listening skills, understanding, interpretation, and comprehension. Can you grasp the information relevant to your treatment? I want to assess your retention of information. Can you remember the information long enough to make a decision? I want to assess whether you can perceive, interpret, and evaluate information. Can you weigh the pros and cons of different options and understand the potential outcomes? I want to assess your listening and communication ability. Can you verbalize or communicate your decisions effectively? Let's now focus on addressing mental capacity and its effect in therapy. The first item I'd like to discuss is psychoeducation. Teaching you about mental capacity and its implications can empower you to take a more active role in your care. This involves explaining what mental capacity is, why it is important, and how it affects your participation in therapy. The second item we should talk about is supportive strategies. If you have impaired mental capacity, implementing supportive strategies is crucial. This might include using visual aids, simplifying language, providing frequent summaries, and involving family members or caregivers in the process. The third item that's important is the principle of collaborative decision-making. Being engaged in collaborative decision-making with me fosters a sense of autonomy and respect. Even when mental capacity is limited, you should be involved in decisions about your care to the greatest extent possible. The fourth item needing careful attention are the ethical considerations when determining mental capacity. Respecting your autonomy is a fundamental ethical principle. This means acknowledging and supporting your right to make your own decisions, even if those decisions differ from the recommendations of your healthcare providers. Healthcare providers must balance the principles of beneficence, doing good, and non-maleficence, avoiding harm when considering mental capacity and informed consent. The fifth and last item in addressing mental capacity is the importance of monitoring and reassessment. Given that mental capacity can change over time, ongoing monitoring and reassessment are essential. Regularly checking in with you can help identify any changes in mental capacity and allow for adjustments in my therapeutic approach. Here are some tips and skills for cultivating mental capacity. Enhancing mental capacity involves engaging in activities and practices that challenge and stimulate our minds. Here are some key strategies to consider. Learn how to be a critical thinker, how to evaluate the information you receive, and how to seek and find accurate, reliable, logical, rational, valid, and unbiased information. Learn how to weigh the pros and cons, find solutions to problems, assess the evidence, and make sound decisions. Engage in a lifelong learning journey. Continuously seek out new knowledge and experiences, seeking out people from different cultures and learning about and from them. Enroll in courses, read books, and engage in civil discourse through intellectual discussions. Implement informal and formal mindfulness and meditation. Practice mindfulness and meditation to improve attention and reduce stress. Meditation can help enhance focus and emotional regulation. Participate in a physical activity and exercise regimen. Regular physical activity has been shown to boost cognitive function and overall brain health. Develop and follow a healthy nutrition plan. A balanced diet rich in essential nutrients supports brain function and mental clarity. Nurture your social connections and friendships. Engage in meaningful social interactions to enhance cognitive and emotional well-being. Get an adequate amount of quality sleep. Prioritize quality sleep to ensure optimal brain function and memory consolidation. Let's take a moment to discuss federal and state laws concerning informed consent and mental capacity. The Patient Self-Determination Act of 1990 is a law that ensures patients are informed of their rights to make decisions about their own health care, including the right to accept or refuse medical treatment and the right to create advance directives. The Health Insurance Portability and Accountability Act of 1996, while primarily known for protecting your privacy, also reinforces the importance of informed consent in health care by ensuring your rights to access your medical information. As for state laws, each state has its own laws regarding mental capacity and informed consent. These laws can vary significantly, but they generally follow similar principles. For example, most states have specific statutes that outline the criteria for determining mental capacity and the procedures for obtaining informed consent. State laws also address situations where individuals are deemed to lack the mental capacity to make decisions. In such cases, courts can appoint a guardian or conservator to make decisions on behalf of the individual. Several Vermont statutes and regulations govern these aspects. Title 18, Health, outlines various health-related laws, including those related to mental health services and informed consent. Title 33, Human Services, includes provisions for services to minors and individuals with disabilities. The Vermont Statutes Online provides access to the complete text of these laws for detailed reference. Changes to the statutes from current legislative sessions typically do not get published online right away, and the time lapse varies from year to year. The laws in Vermont have recently changed, so I have to remain aware of these laws, including changes to the laws, and be sure I adhere to the following. Conduct thorough assessments of mental capacity. Respect the rights and identities of LGBTQIA individuals. Seek appropriate consent from minors and their guardians when required. Follow ethical guidelines and legal mandates for court-ordered counseling. And document all informed consent processes meticulously. It is important for me to let you know that insurance companies require that you meet the criteria and are diagnosed with a DSM-5 disorder, and the disorder is having detrimental effects on multiple areas in your life. Being court-ordered to attend therapy does not guarantee reimbursement from insurance companies. Before we conclude our lesson in this video, we also need to talk about special populations. We will first discuss the special considerations needed for minors. Informed consent for minors typically requires the involvement of a parent or legal guardian. However, there are exceptions for certain medical treatments, such as reproductive health services or mental health care, where minors may be able to consent on their own. Special considerations are also required for individuals with cognitive impairments, such as dementia or intellectual disabilities. This may involve tailored communication methods and involving caregivers or legal representatives. This video was but one small part of your therapy program, treatment plan, and the health and wellness program, Strengthening Your Conscious Self. In future videos, we will delve deeper into addressing and cultivating mental capacity in each of these principles and strategies, providing practical tools and exercises to help you strengthen your mental capacity. Remember, enhancing your mental capacity and improving your intellectual strengths is a journey, not a destination. It requires consistent effort, self-awareness, and a commitment to personal growth. As we embark on this journey together, I encourage you to approach it with an open mind and a willingness to challenge yourself. Together we will explore the vast potential of the human mind and learn how to harness it for a healthier, more fulfilling life. Thank you for joining me in this introduction to mental capacity and informed consent. Let's continue our journey towards a stronger, more conscious self. Please take a look at all my video content. Let me know if you have any questions, comments, concerns, or philosophical rebuttals. Please give this video a like and subscribe to my channel if you don't want to miss any of my content.